able to be here with you today. Thank you very much for having me. I want to tell you about some places around the world where people live 10 to 12 healthy, robust, playful years, longer than we do in the United States. And they do it with just a fraction of the chronic diseases that we struggle with. Next to no obesity, diabetes, heart disease, cancer, or even Alzheimer's disease. These places are called blue zones, and they were identified by National Geographic fellow Dan Buettner. And they have amazing secrets that I want to share with you today. The idea is, by mimicking these blue zones, we can create environments that are healthier to eat, play, and live. But let me back up and tell you where we started our research. Something called the Danish Twin Studies established that about 80% of how long we live is based on how we live, our lifestyle, our habits, and our culture. And only 20% is based on our genetics or our access to basic health care. So what we wanted to do was find these populations around the world where people were doing it right. Where are the people living the longest, healthiest lives? So with the funding from National Geographic, we were able, over 10 years, to be able to find these 5 locations. It's Okinawa, Japan, Ikaria, Greece, Sardinia, Italy, the Nicoya Peninsula of Costa Rica, and Loma Linda, California. It's people like Ed Rawlings, who's a 103-year-old working cowboy, and on the weekend he likes to water ski. Or Kamada from Okinawa, she gets to share her wisdom and help take care of her great-great-granddaughter. So that's 5 generations and 101 and a half years that are between these 2 ladies. And these ladies have been gathering together in something that's called a mawai. It's a group of lifelong friends, and they've been gathering since they were 5 years old, which is over 90 years. They've been able to support each other and share the ups and downs of life together. A real, true social network. Remarkably, when we go to all 5 of the Blue Zones locations and study their habits, the things that they do, their lifestyle, we keep seeing the same 9 things come up over and over again. And we call these the Blue Zones Power 9. The first is move naturally. So all day, every day, they're moving throughout their day. They're taking care of their homes and their properties. They're walking. Very much like Deb was saying, they don't have their cars in the communities where they are. So they're constantly chopping wood, taking care of their garden, and moving. The next level we call the right outlook. So the first part of that is to know your purpose. In Okinawa, the word that they use is ikigai. And in Nicoya, the words are plan de vida. It's the reason that they wake up in the morning. They're very highly revered in their culture, and they're seen as the elders and very important. The next is downshift. So every day, they're taking time to de-stress, to decompress. That could be by taking a walk in nature, by praying, by meditating. They really are purposeful about taking a break from the hecticness, even though their lives are quite simple. Our next level down is eat wisely. So not surprisingly, they eat fewer calories than we do in the United States, typically with smaller portion sizes. They eat until they're about 80% full instead of overeating at a lot of meals. And they eat a mostly plant-based diet. So this means fruits, vegetables, grains, and next to no processed food. And here's a favorite for a lot of people. They have a small amount of alcohol every day. Typically, it's a glass of red wine for the most heart health benefits. And our bottom level of our pyramid is belong and connect. So it's social networks. Again, from the Blue Zones, we know that friends really matter. They do have a very strong sense of faith, and faith is very important. We don't advocate for any particular faith, but we do know that going to services does make a difference. And they also prioritize family. So that's across generations. The benefit for parents, grandparents, and children is really beneficial when the family is supporting each other and spending time together. So what does this mean for individuals and also for communities? How can we take this information and really make it work? We know that Americans are not great at adhering to diet and exercise programs. We can all start them, but it's hard to keep them going. It doesn't matter if we're motivating people through incentives or through penalties. It's really hard to keep that going in the long haul. So we knew that if we're going to take this information from the Blue Zones and apply it, we needed to come up with a new model. So we asked some thought leaders to come to our office and talk with us about different things and find out what would be the components that we would want in a model to make it most effective for a community. We knew from our research that the most successful public health programs around the world, and there's not very many that have been successful over the long term, they have made long-term changes to the environment. So that was what we wanted to focus on, blending the Power 9 with long-term changes to the environment. So we came up with this concept, working with our thought leaders, of a life radius. And our research showed that about 80% of our time is spent within about 20 miles of our home. So those were the diameter of what we really wanted to focus on. And we decided to focus on these 5 levers. The first is policy. So that would be things like, is it easy to smoke inside, outside, in parks, in restaurants, in bars, in workplaces? Optimizing things so that it was easy to get access to fresh food, not having food deserts, or keeping supersized sodas and salty snacks easily accessible and the least expensive thing. We wanted to use policies to create healthier choices for people so it was easier to make those choices. Policies are really the longest term thing that you can do to make an impact in health and well-being in a community. The next is your built environment. So that's your infrastructure. It's things like paths. Is it easy to get around in downtown? Would you want to go downtown? Are there places to play? Are there places to sit and relax and enjoy spending time with each other? Can children get around? Can elders get around? It's using the resources that you have to make the most accessible decisions around the built environment. The next is your social network. So we know from the Blue Zones that being social really matters and the people that you spend time with really matters. And we also know from the Framingham research that Nicholas Christakis and James Fowler did that social networks matter up to 3 degrees of separation. It's very much like how a cold would, it's like an epidemic, the way that it would spread through a community. So 3 degrees of separation means if I'm happier around my daughter, I not only impact her happiness, but I impact her friend's happiness and even the happiness of her friend's mother. So the social networks and the depth and the breadth that you can impact by creating, again, fun, interesting activities for people to do, safe places to do them, and have people be engaged and challenged and really enjoying time together can make a big difference. The next are your building's designs. So this is the places where you spend the most time. It's workplaces, schools, restaurants, grocery stores, and home. Again, what you want to do is make sure that there's healthy choices available and that people are engaged and that the healthy choices don't even require thinking or making that decision. It's just set up to be optimal for the health. And again, inner self or purpose. One of the big things we learned in the Blue Zones is that purpose matters. So having individuals know what's important to them, what are their gifts and talents, and how can they contribute those to their families, to their workplaces, and to their community really makes a big difference. So as you can see, there's no one answer for optimizing the health or well-being of a community, but it's a lot of these little things that all play together and support each other to make it an overall system that works. We've actually had a chance to apply this a number of times. The first time was in 2009 in a town called Albert Lea, Minnesota. We did a statewide search. Blue Zones, our organization, is based in Minneapolis. So we did a statewide search to find a statistically average American city that had the same levels of obesity, smoking, diabetes, cancer that most of middle America is dealing with. And we wanted to see if we could apply this system and really make a change in their community. So with funding, again, from National Geographic, from AARP, and the United Health Foundation, we created what we call a perfect storm and had them implement about 4 dozen different ways to optimize their community, all within that same 12-month period. This is Dan Burden, and he is our livable communities expert. So he worked with the communities and listened to the city leaders to find out what were sort of the the infrastructure and the policy changes that would be most impactful. What they wanted to do was widen the streets into downtown and make it a thoroughfare. They thought that that would bring more people into downtown. But we shared with them the idea of adding more parking, adding some green spaces, adding a bike lane so that it was easy for people to get from the neighborhoods into downtown. And now they have farmers markets, they have block parties, they have community events, they have art fairs that all bring people into downtown and actually increase the traffic that's in front of the businesses, much more so than the thoroughfare would have done. Also, Albert Lea has a beautiful lake. You can kind of see it down here in the corner of that picture. But they didn't have paths and trails all the way around the lake. So what we helped them do was identify places where they could complete that trail and also connect that trail all the way around the lake with biking and walking and hiking, as well as into downtown again and out into the neighborhoods. So that was all connected to provide safe access for people to exercise and to spend time together. We added about 100 community gardens so that there was fresh produce available for families, for workplaces, for schools, and for senior retirement communities. We worked with Brian Wansink from Cornell University in food services and restaurants to make sure that there were healthy choices that were easier and fun to order and were also cost effective for the restaurants. And also attractive. It's really important if you're going to provide that food that people want to order that food. We also created a labeling system in the grocery stores so that it was easier for people to shop and that they knew what food was healthy and could make the most impact. We also created a Blue Zones checkout lane in convenience stores and grocery stores so that the grab-and-go items weren't the typical candy bars and salty snacks, but they were healthy and nutritious options. In the schools, we did 9 different policies. One of the most popular was a walking school bus. So that was a way to get children to walk to school and encourage that activity. It adds about 4 miles total to their weekly activity to have a walking school bus. And we paired seniors in the community to help supervise that and be the chaperones for the school bus. We also created nutritious policy changes so that they had better snack carts, better vending machine options, and also better concession options. And some other, there was a farm to school program that we did, and then community gardens in the schools. So the schools were a great advocate of our program. And even for families, we had some ideas that families could use to optimize their homes. This is the Furlan family, and you can see that they now eat off of 10-inch plates instead of 12 or 13-inch dinner plates. They have a fresh fruit bowl on their table at all times, so it is full with fruit and nutritious snacks that they can grab and go. And the salty and sugary snacks are sort of tucked away in the cupboard. They're not removed from the home entirely, but they're harder to get to. And the piece of fruit is the easier option for them. Bob, the dad, now stays at home in the morning and has breakfast with the kids. And this is instead of what he usually did, which was having Mountain Dew and Ho-Hos on his way to work. And in the first 6 months that he did that, he lost 12 pounds without ever going on a diet. And the boys got rid of the television set in their bedroom and now spend more time outside playing and especially working on their soccer skills, having fun with their friends. We know from the Blue Zones that friends really matter, so what we did is we created fun, social activities. Instead of telling people just go out and walk, you should walk to get your exercise, we created what we call a walking moai, based on that concept from Okinawa, those friends that spend time together. And we also created volunteering moais. So not only are they doing a positive activity, but they're also connecting, spending time together, sharing the ups and downs of their lives. And for the individual, we held purpose workshops, again, to be able to identify what is the biggest gift that is important for them to contribute, what are the talents and passions that they have in their life, and how can they use those in their families and their work and also in their community. And immediately following the purpose workshops, we connect people with volunteer opportunities so that they can start to use those talents right away. Volunteering is actually probably the #1 thing that you can do to increase your well-being. It's very positive. So, was our health experiment successful? We certainly think so. 24% of the community participated, and 100% of the public school kids participated. They lost a collective 12,000 pounds over the course of the year. They added an average of 2.9 years of healthy longevity. The city reported a 40% reduction in their healthcare costs from year to year, and employers reported absenteeism down by 18%. But the thing that we're most proud of is people talked about feeling healthier, feeling better, spending more time with their friends, spending more time with their family, having a renewed zest for life, and being proud of living in Albert Lea and being able to accomplish that together as a community. And the other thing is, now 4 years later, they continue to add more and more programs that help their community be healthier. So they really look at everything that they decide to do through Blue Zone's lens. They internalized it. They understand what it means to use the model that we set forth for them. So this really is a sustainable program that doesn't require additional funding because the people understand it and now can carry it on their own. We've continued to do this in lots of places around the country. We're doing it in 3 communities in the beach cities of Los Angeles, in 20 communities in Iowa, in Fort Worth, Texas, and now also in Hawaii. In our first 2 years of being in the beach cities of LA, we saw a 3-point jump in well-being. So now we have a nationally recognized tool. It's called the Gallup Healthways Wellbeing Index, and this is a way for communities to be able to assess their well-being as well as the economic impact of well-being in their communities. So a 3-point boost in just the first 2 years that we were there is a $9.32 million savings in healthcare costs. That's because we know that when well-being goes up, the need for healthcare goes down. Hospitalizations go down, trips to the doctor go down, trips to urgent care and the ER. They all go down when well-being goes up. And these are some of the other statistics that we saw in the beach cities in those first 2 years. A 14% drop in obesity. That's over 1,600 fewer people are obese in that community. A 30% drop in smoking reflects over 3,000 people are no longer smokers in that community because we helped them change some of their policies to make smoking more difficult. We also have a 10% increase in exercise and a 9% boost in healthy eating. So we found out that you can change environments and really have an impact on the health and well-being. And what does all this talk about healthy living and a sense of purpose and connection with your friends and connection with your family remind you of? Well, it's exactly like life in the Blue Zones. And it seems a lot like life where Deb grew up. And it's actually possible to take these same ideas and apply them into your own community, even right here in New Jersey. So I challenge you to think about some of the things that you heard and thought about today and see if you can implement some of those into your own life, or maybe even reach out to friends and other community members that you met either here or that you know of, and see if you can make your community more like the Blue Zones. Thank you very much.